We are pleased to introduce our newly installed 2014-2015 President of the College of Family Physicians of Canada, Dr. Garey Mazowita. Congratulations, Dr. Mazowita.
Thank you very much.
Can you tell us a little bit about your involvement with CFPC that ultimately led to your installation as President?
Sure. I suppose initially it was as a member of CFPC. In fact, when I started practice, I had done a rotating internship and so knew very little about the college. I did have some of my classmates who went into the family practice residency. When I started practice, it was actually my partner that I joined, who himself had been a chapter president in Manitoba, and said, well, you have to be a member of the college. And then subsequently I had joined a teaching unit after a number of years in private practice, and of course that brought me closer to college activities, to education, to research. But I have to say that where I really became engaged was when I joined a college committee. And really began to appreciate the scope and the depth of the work that the college does. I happen to be on the SOO committee, the Simulated Office Oral Committee, and it was, you know, as I think back on it, I think it was probably one of the most enjoyable committees that I've experienced. Meeting people from across the country, really having a bit of an ownership role in establishing some of the oral exam questions of the college, and then being able to see how different centers did and try to improve what we were doing. So that was thoroughly enjoyable. Along the way, I became chapter president in Manitoba, and then really felt very, very honored when I was asked if I would consider to sit on the executive.
What do you see as CFPC's current challenges facing you as the new president?
My goodness, it's you know, I don't think we've ever been in such a time of profound change in healthcare. It's interesting to me. We began this conversation, you know, 20 years ago with Romano, and it's really just now, I think, that we're in the midst of change. So it's, I mean, it's relationship with our sister organizations as we try to be much more collaborative and have more of a I think a strategic, consensual approach to where healthcare has to go, and the part that we play as a college and that our members play. So that's that I think is just going to strengthen as we go. The very nature of family practice is changing as we have concerns about work life, as we have more family doctors who gravitate towards more focused practices for a variety of reasons, for community need, you know, because of choice. And yet at the same time, we have to make sure that we pay attention to our core, because I think as a Canadian society probably still identifies us with, and I think it's fair to say, you know, our funders most value our role as comprehensive generalist physicians who provide continuity of care in communities big and small. So that's something we really do have to pay attention to. The curriculum changes, the CCC competency. Patient medical home is a huge one. I think that increasingly we're finding that not only our own members and chapters, but I think it's fair to say health authorities, provincial governments, sister organizations are really seeing themselves in the medical home and in the kinds of opportunity it affords to really start to look at accessible team-based care that's integrated with the rest of the system. So those are some of the challenges. Yeah.
Okay, thank you. As a family physician, what aspects of the profession have you found to be most rewarding?
Oh dear. That's really hard to answer. You know, I've done a lot of things along the way for periods of time, and that's one of the beauties of family medicine, is that often you get pulled into kind of side things. So, I mean, I started out with a very broad general practice. You know, and as your patients age, you become involved in nursing home care. Initially, the community hospital where I was a department member, it was our job to fill the 4 to midnight emergency shifts. We did that as a department. So that continued for a number of years. For several years, I had an opportunity to be one of the attending in our community hospital intensive care unit. That was a great experience in terms of really solidifying some of my acute care skills. There was a federal prison outside of our teaching unit, and so for a number of years our family practice residency training unit provided medical services and call services. I did a bit of fly-in work up north. Teaching was fabulous. I mean, I think we all should teach. I don't think there's anything that keeps us as grounded, perhaps with the exception of our interactions with our patients, as teaching does. And it's interesting, you know, I think we like to say that we're doing it for our profession and for our young learners, our residents, the family doctors of the future. If truth be told, I think a lot of the reason we do it is because there is no better way to keep current than to engage and interact with residents who are coming up, you know, coming through the system with the latest information. And we have an ability to kind of contextualize that information. So I mean, all of these things have been very gratifying. As my career went on, being more involved with administration was another thing that, while not as enjoyable as clinical care, I think in many ways was as important for different reasons because of all the changes occurring. So I'm not sure I can really answer the question as to, it was all enjoyable. And you know, therein lies the attraction and the wonder of family practice.
I think you answered the question. Yeah. And you've done a little bit of everything.
Yeah.
You've been involved in many aspects of the medical field. Currently, you're a professor at UBC and find time for research and clinical practice. You're a member of 2 committees with the BC Ministry of Health and co-chair of the Vancouver Coastal Health Authority Interdivisional Council. So, how do you find time to manage balance work and family life?
Yeah, I think that's probably the thing I've done the least adequate job of, like many of my colleagues, I have to say. You know, in part I think it's because the work itself is so enjoyable, but you know, I think one does the best one can in terms of making sure that you know, when we are home, that we pay attention, we really try to be you know, engaged with the family. A supportive partner is a huge plus, and I mean, for me it's tended to be I think identifying some periods of time and making arrangements to unload all my responsibilities. That's so for you know, 2 or 3 times a year, I know I've got an uninterrupted, you know, 7 or 10 days where I can do my best to make the most of the time. That's right, yeah.
Okay. Thank you for speaking with us this morning. We wish you well in the year ahead.
Thank you very much.